Welcome, everyone. We're just going to get started in a minute as everybody joins. All right, I've just lost my slides. Can you see my slides?
Yes, we can. Yes.
Okay.
Not now.
Okay, I'm going to reshare them because I somehow lost. There we go. Great. Good. Okay, we're 1 minute after 1. I think we'll get started. Welcome, everyone. Delightful to see everybody that's joined today for this session on Indigenous health and long COVID. My name's Susan Law. I'm the long COVID web knowledge mobilization lead, and really delighted that we have our guest speakers here today. I'm going to start with just a short introduction and recap of a land acknowledgement and how we run these sessions. But first, we wish to acknowledge this land on which the Long COVID Web operates. For thousands of years, it has been the traditional land on the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Thank you. So just a recap of the purpose here. First, to share evidence-based information, research results relevant for decision makers, researchers, clinicians, patients and families, and the general public. These are our different audiences for Long COVID Web. Secondly, to provide ongoing updates and spotlights on emerging evidence, as well as scientific information on the activities of our national network. And thirdly, to contribute to reducing and managing misinformation about long COVID. We do have a code of conduct for our work, and the link to that is at the bottom of this slide. We value highly engagement around the science and its interpretation as well as application. A commitment to reasoned discourse, as stated in our code of conduct, comes with a responsibility for all of us to ensure that any comments or questions remain within the spirit of positive, constructive, and respectful discussion. So we welcome any or all questions and comments in this spirit. Our participants today, for you, the cameras and mics are off, but please post any and all questions in the chat at any time during the session. We will pause for Q&A after each speaker or each session. In this case, we have 2 speakers per session. And we will do our best to review and address as many questions as we can during the time that's possible. These sessions are recorded, and with permission from the speakers, the session will be posted online following the webinar. And we do welcome your thoughts about how these sessions could be most helpful to you. We have a very short feedback survey that we will post in the chat for you to respond to. That's the link to the webinar, but we'll put it in the chat for you later. So thanks very much. We will turn now to our first set of speakers. We have Farwa Naqvi, who's here with us from Long COVID Web, part of our operations team. She is both the patient engagement lead as well as the Indigenous engagement lead for Long COVID Web. And she is joined by Kienan Williams, who is the program lead for innovation and research with the Indigenous Wellness Core. He's a member of Sandy Lake First Nation, a fly-in community located in northwestern Ontario. And he's worked with First Nation communities across Canada, providing knowledge and expertise in areas of governance, comprehensive community planning, housing, justice, education, and early childhood development. So we welcome both of you, and thanks for your comments today. Over to you, Farwa.
Thank you. Thank you, Susan. And I just wanted to do a land acknowledgement from where we're at. Me and Kienan are both in Alberta, so I will just like to honor the land. So I'm in Calgary, and we're located in the heart of Southern Alberta, and we both acknowledge and pay tribute to the traditional territories of the people of Treaty 7, which include the Blackfoot Confederacy, composed of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, the Stoney Nakoda, including the Chiniki Chiniki, Bearpaw, and Goodstoney First Nations. And the city of Calgary is also home to the Métis Nation of Alberta District 5 and 6. And Keenan, if you'd like to comment on anything.
Thank you, everyone. I'm excited and appreciative of this work. I know I've been involved with Long COVID Web since the proposal stage, and there's definitely been an inclusiveness and space for active Indigenous streams in terms of addressing and supporting long COVID work, support, research, and everything. So, what's exciting about this year, and part of the reason for today's call, is a little bit of hope. We've got some good work. We have Farwa um, hired and highlighted and now engaged and embedded within the long COVID web. And I'm continuing to work with her, but it's nice to have some dedicated resources for an Indigenous specific stream and making sure we can support Indigenous voices in this work. We have had conversations over the years, really supportive, but I think the challenge can be what's the top health priority? What's the immediate response to come upon? And also some of the Indigenous specific components to immunization and institutional trust. So we always knew that it would be a longer runway period on this particular project for Indigenous voices and involvement and support. So that's what we really want to highlight for this upcoming year. The two of us are here. Our goal and our focus is building rapport and capacity with First Nations, Métis settlements, urban Indigenous people, Innu in the territories and their territories. So our aim is to get out and be able to support how long COVID web, which is already established, reaching and gaining entry and appropriateness of materials for our population. So how will we do that? Specifically, we're partnering, and I always have to look it up. We're already connected to the community of practice with SPORE, and SPORE is the strategy for patient-oriented research. There's an Indigenous specific SPORE community of practice. We have communicated them there last year, but the engagement and involvement can be a lot richer and stronger with Farwa's support, to be perfectly honest. I could pitch and support, but there's only so much time and capacity that I was able to do. So that will be a key involvement. And what we're doing now is scheduling pitch to the BC Spore in particular, where A, they've already had some recruitment opportunities, and B, they've got a strongly engaged community of practice. Many of us do, but it was just fortuitous opportunistic. So we're working on that scheduling now. If anyone on this call or in the future recording has an opportunity that they'd like to invite us, we'll make sure talk to Farwa. That's the best point in contact, and we can get a hold of us. And I think the last opportunity that I just want to highlight is about the Patient Advisory Council. So we have a spot on the governance table for our voices, and I think it's very appropriate to fill. And now we're coming down to clarity on what those commitments are, what the requirements are, but there's space, and I fully support the leaders at this table and beyond to be able to say, yeah, this is not a tokenism opportunity. This is a legitimate, and we want to be heard and be forward. So I just want to say that's a huge recruitment and strength opportunity to be able to say, not just are we looking to send stuff at people, but we've got a little money, we got a bit of money, and we've got role in the governance tables. So those are my two big checkpoints to let's have a chance to work together well. So ultimately, I'd just like to say stay tuned. I look forward to saying hello at our engagement and relationship building type stage. And I look forward to the next reporting accountability period to reporting back to everyone to say, not only this is what we attempted and tried, but here's what we were able to deliver and follow through on. I'll toss it over. Farwa, is there any additional comments?
I think, Keenan, you summarized it so beautifully that I will just echo the point of the Patient Advisory Council, the PAC, which I manage. And it is very important for us to honor diversity inside the PAC as well and have Indigenous voices as well. So this is something that, like Keenan said, is what we're working on. And our goal is to have more of an Indigenous voice in long COVID research and long COVID web. So stay tuned, as Keenan said, and hopefully we will be strategizing and fulfilling that capacity better. And I think, Susan, that is it from us.
No, that's terrific. Thank you very much to both of you. And we do very much look forward to this work and realizing some of those objectives would be terrific. So thank you. Farwa, I wonder if you could put your email address in the chat, just so if anybody has any follow-up. And I also invite anybody to put any questions for Farwa or Kienan in the chat, if you have them. And I just wonder also, Angela, if there's anything you would like to say as the nominated principal applicant for this whole project.
Thank you. And I do have to thank Kienan for working and partnering with us, like since the very beginning, when we were putting this group together. And he has been sort of a faithful partner in terms of like helping us along the way as well, in trying to connect with Indigenous communities and also figure out what may be most pertinent as well to those communities. And so thank you, Kienan. And we welcome Farwa, who joined us more recently to help with this piece. And I look forward to hearing from our speakers today as well, Maria and RJ. So thank you.
Thanks, Angela. And seeing no questions there, I think we can just say thank you to Kienan and Farwa, and perhaps we can move on to our next speaker. So thanks so much. So now I'd like to welcome Maria Diaz Vega, who is going to provide an overview of a project on Indigenous health and long COVID in Saskatchewan that's underway. And she is joined by her colleague and partner, RJ Morin, who is working from Northern Saskatchewan and is a member of the Project Advisory Committee. So thanks very much to Maria and RJ.
Thank you. I will share my screen.
Thank you.
Can everyone see my screen?
There it is. Yes, it's working now. Thank you.
Okay. So my name is Maria. I am going to talk about this project that is ongoing. It's not completed yet, but it's in progress. And I have the honor to be here with my with the knowledge keeper that works with us in this project. So his name is RJ. He will come soon. So the title of the project is Exploring Long COVID Among Métis People, a descriptive phenomenological study of lived experiences and support needs. I would like to, as we gather here, I would like to do the land acknowledgement. As we gather here today, we acknowledge that we are on Treaty 6 territory and the homeland of the Métis. We paid our respect to the First Nations and Métis ancestors of this place and reaffirm our relationships with one another. So we're going to go today through, we're going to do a little bit of an overview with long COVID. We've heard it lots, but just a little bit. We're going to do a background and explain why our project is important, the objectives of our project, the approach we're using, the method, the interview guide we created, the data collection process, the data analysis, and the preliminary results. So long COVID is also known as post-COVID condition. However, for the sake of this presentation, I'm going to go with long COVID. And I would just like to go through the definition that the World Health Organization has. Post-COVID condition is defined as the continuation or the development of new symptoms, 3 months after the initial SARS-CoV-2 acute infection, with the symptoms lasting for at least 2 months with no other explanation. These are the main symptoms that have been reported for the long COVID. However, has been reported over 200 different symptoms, and they have been reported including like gastrointestinal like problems, rashes, but the most common one are these ones that appear here. And something very important to say that it's that everybody experiences this long COVID in a different way, and not everybody has the same symptoms. A study found that mental health disorders are extremely common with patients with long COVID. A large study conducted in the US found that people experiencing long COVID were approximately twice as likely to report depression, anxiety, and symptoms than other adults in the United States. Why we're doing this project? Why is important? Métis have found to experience a poor health outcome compared to the overall Canadian population. Indigenous people were very affected disproportionately with chronic health conditions, which includes the long COVID as well. And the rate for long COVID, there's a study that was conducted by Ismail and colleagues that mentioned that the rate of the COVID infection among Indigenous people were more than twice as high than the overall provincial population. The objectives of our study is to explore the experiences of long COVID among Métis people in Saskatchewan. One important thing to highlight is that Saskatchewan has one of the biggest populations for Métis people. So this is why the study is conducted in Saskatchewan. And one of the main goals is to inform in the development of services and supports to improve the well-being of Métis people with long COVID in Saskatchewan. Our approach, since we're conducting Indigenous research, we highly value and stand for the community-based research approach, where we partner with the community and we work with them in partnership, and every step is consulted along the project, because this gives you the opportunity to have many lenses involved and reduce your bias. You have community involved, you have MNS, this research is funded and partnered with Métis Nation Saskatchewan. So based on the community research-based research approach, we form a research advisory committee. And this research advisory committee is comprised by Métis knowledge keepers, Métis Nation Saskatchewan, and USask Research. I'm going to let RJ explain a little bit his role as a knowledge keeper in this project. So I'm gonna handle it to him.
Okay, good morning, everyone. So again, thank you, Maria. My role as a Métis knowledge keeper is actually is very simple. I know there's a lot of people that are, a lot of Métis people that are still using the old language, as I call it, their first language being Métis or Cree. So when they have these questions, or when they meet with the people that are doing the interviews, they might have not a clear understanding of what the English language is asking them. So I, in my gentle way, the way that I was taught by the elders, I help them along with the question. I explain the question in either in Michif or else in Cree, and I go through the question and I make them feel comfortable. That's a big step, is for them to be comfortable in answering the questions, and if they want to answer in their first language, either Métis or Michif or Cree, and then I translate their answer from their first language to the English language, and I make them comfortable enough so that they will share their knowledge, and I explain to them in their language that what we're doing, why we're doing this, and what we're trying to accomplish with this process that we're going through. So my role as a knowledge keeper is very important, more so because there's a lot of elderly people now that are not comfortable in talking the English language. So I help them along whichever way I can, even going as far as making sure that they have, that the people that are going to be interviewing know that there is a protocol that they need to follow in order for them. Be it a simple thing like making sure that they have a cup of tea, that kind of stuff, so that they make the elder very comfortable, and then we take it from there. And it's Cree is a language that's being used right across the whole province and across Canada for that matter. And we have different versions of it. So, it's a lot of fun trying to know a lot of these things at the same time, the language at the same time, learning new ways to talk to the elders and enjoying their company. So that's, in a nutshell, that's basically what my role as a knowledge keeper is. Thank you.
Thank you, RJ. So we wanted this, when we were starting to create this project, we wanted to be inclusive, respectful, and effective to address the needs of the Métis community. But we also feel like it was important to honor the cultural heritage and the knowledge. So that's why this project found very important to have this research advisory committee. And on the other side, we also there's an overall survey for the entire Canadian population about long COVID and its symptoms, its development, treatments. So what we did with that survey is that we meet with a group of Métis people that suffer long COVID, and we went through the survey and we tailored it specifically for them. For example, we include traditional medicine. They had a couple inputs to be more Métis specific. We include cultural things from them. And this survey will be launched through MNS. So they will do to this app, Avicenna. They will have a wide range variety of surveys. And our long COVID survey among Métis people would be one of them. So this is just an upcoming and project that is coming. For the method, this study uses descriptive phenomenology to explore and describe the experiences of Métis individuals. We think that using a descriptive phenomenology will be very appropriate since it's only describing, we're not using interpretation. So therefore, we're trying to respect their voice as much as we can. This method would also help us to gain insights to develop support systems that address the specific health needs of Métis people with long COVID and inform future practices, policy, and research. So we meet all together with the Research Advisory Committee, Métis Nation Saskatchewan, knowledge keepers, USask researchers, and we went through what questions can we ask them, what could be included in this interview guide, and we included questions about the following themes that you can see: demographics, symptoms, how was their health before COVID, after having COVID, life changes that has occurred with having long COVID, supports they have and they need, the influence of the culture, and everything that can help them to achieve well-being. For the data collection, we are doing the recruitment in partnership with Métis Nation Saskatchewan. They help us to get to the Métis people through like launching posters to put in the newsletter, in the offices, in events. So we're getting participants. We're doing some instructor interviews conducted by phone or Zoom, based on whatever the participant prefers. But when conducting this research, I found it very helpful that Zoom was helpful because some people don't feel more comfortable not showing their face while they talk. So that has been something that has really helped the participants express themselves and say whatever they want. And we also have the option of co-interviewing. As RJ mentioned, if somebody doesn't speak English, we can have RJ be in the interview with us and they'll feel more comfortable. Sometimes some participants do feel more comfortable with them. So for the data analysis, we will use a thematic analysis that will be grounded in descriptive phenomenology. The data will be analyzed also along with the research advisory committee. This is to reduce bias, so make sure that many lenses come to the table and many lenses participate in this analysis, specifically the community being there and involved, right? I'm going to present the preliminary results. However, I want to be very clear that this research is in progress and this is just the first impressions. This is not a conclusion yet because the study is still going on. So for the participants of the study, I have the youngest participant is 29 years old and the oldest participant is 71. So they're like early 30s the most. I haven't had any younger than that. And also, as we can see, it's remarkably more females than males, and the greatest age that has more like symptoms of long COVID, like stronger, is 40 to 59. Then for the locations, this is the location, the display where have the participants that we recruited are from. So just to give you an overall idea. And from the initial impressions, so consistent with other researchers, this research also finds that there's a higher prevalence in females and males, that it's common among individuals from their 30s to older adults. Also often worsen existing comorbid conditions. So if a person has asthma and then they have long COVID, the asthma has become worse. The symptoms are they're suffering more, like the attacks or the asthma. Or same with like cardiovascular diseases. All the symptoms just have increased. There's also severe depression is frequently reported in long COVID. Specifically, the depression could be higher when participants don't report having supports available. So they are having more higher depression, and also when when participants don't like have longer time being sick. So there's participants that have been for years with this condition, and there's like they report the lack of hope and like healing. Many participants rely on multiple medications that often has strong side effects. So what happened with this, and this is going to be really challenging when doing the data analysis, many participants go to the doctor and they get diagnosed something else. For example, I'm going to put an example of Xanax. That's a medication that automatically can cause being tired, overtired, like lots of sleep. And then if they're taking that medication, but they're also reporting these symptoms, it could be really hard to identify if it's the medication or if it's the actual long COVID. The symptom and the severity vary from one person to another. I have talked to persons that are totally have the symptoms and I can tell they do have long COVID, but they're not struggling as much as others, or it's not as intense as others. So it's totally variable. And as I mentioned in the beginning, not the same symptoms present from one person to another. One of the main gaps that the participants come and bring in this, they're interested in learning about traditional medicine, but they don't know how. There's not a resource available for them. And I'm gonna let RJ say if he wants to say something about traditional medicine.
Yes, thank you. There is how can I put this in a good way? There are, I know for a fact there is a lot of people that have used traditional medicine when they had COVID, more so up here in the north, and they have stated that the medicine that they gave us to use is actually working, but they don't want us to give them the names of the people that are doing this for whatever reason it is. But so I've asked the people, I said, can we use the modern medicine that we have now with the COVID, the shots, the booster shots, etc., etc., and then also use the other kind of medicine, the traditional medicine? And they said yes, it's just like everything else. But he said, in reality, you don't need to use the other kind of medicine. The traditional medicine have cured a lot of people from the COVID that we had going through our nations here. So myself personally, I really believe in the traditional medicine, yeah, because of my upbringing and me seeing it firsthand that it is working, and it worked for a lot of people. But again, at the same time, it's up to the people if they want to use the traditional medicine as opposed to the other one that was given to us by the doctors and whoever else, the scientists, whatever you want to call them. But myself personally, I used both, and now if I had a choice, knowing what I know about this, I would have stayed with the traditional medicine because I know for a fact that it worked. I've seen it. I've seen a lot of people not having COVID because of the medicine that they got from the medicine people. So it's, I guess it's a choice that people have to make on their own, and I guess we'll just leave it at that for now, and we could have a further discussion on this if need be. Thank you.
So another thing that like Urgent mentioned is like there's a lot of patients that want to use both traditional, but they also want to attach to Western medicine, but they also want to include this cultural component, but they just don't know how and where, or they don't know where to get the information from. There's also been often people like discouraged when they go to the doctor and say, oh, I think I have long COVID, and the doctor normally like says, no, you don't have anything, you're fine. So I have multiple people reported that they've been like discouraged by the healthcare system, and they also have been misdiagnosed. And what happens with a misdiagnosis is that they prescribe a medicine that only works everything, like the symptoms, or a medicine that was not appropriate for them. So they have definitely, most of the participants have wrote this as a huge gap. And what supports do long COVID patients need? So they reported they need increased awareness and understanding of a long COVID among healthcare practitioners. Also, currently, there's not a treatment for long COVID. So every time I have a participant, unfortunately, I wish I could tell them, take this, or in 24 months, you'll be fine. It's going to go. but currently there's no effective treatment or solution for long COVID, and that has been really frustrated for them. And they bring this as a huge gap, that there's need to research that could help them find a solution to their condition. In the meantime, they also identify that it will be really helpful to have a support group of patients with long COVID that suffered long COVID, so they can talk about their coping strategies and how things have overcome. Because some people say like, oh, it will help me to talk to someone that has already gone through it, for example, that has been healed, so that I know, or at least I have hope that it's gonna go. So that's one of the main things that has been brought, and it's all for right now. So if you have any questions, I'm welcome to hear them.
Thanks very much to Maria and to RJ. That was really, really wonderful that this, and actually, as Beth said, it's really terrific that this research is taking place. And I welcome any questions in the chat, and I have a few of my own as well. So we'll turn to the chat now. So there's a question: are there any particular challenges to COVID-19 prevention in Indigenous and Northern communities, like the cost of shipping N95 respirators, less availability of vaccines, and other things? Thank you, from Anna.
Well, to be very honest with you, if I go back to the map, I haven't had participants from the north. It's a little bit harder to reach those communities. However, we were working in a strategy to get there, because the idea is to have the whole sample of Saskatchewan. So overall, from working with Métis people, I can tell there is, let me read the question again.
Yeah, particular challenges to COVID-19 prevention. Yeah.
I think about all the healthcare, there's particularly challenges. There's like, they don't have, sometimes people have to drive a lot to get to a medical appointment or to a doctor. So definitely. And yeah, so I don't know if I answered the question with what we know so far.
Yeah. Yeah, it's a little bit more about prevention. So things that such as, air quality issues, or having face masks or things like that. So I don't know, RJ, do you have a comment on that about preventing COVID in the first place?
Well, I don't know if all know about the north way up here. We have I think the cleanest air in Canada. I just want to throw that in there. But I guess one way is for people to be, to know about this, and because there's a lot of people that don't understand that, just because the politicians and the scientists and the doctors have said that there isn't no more COVID attacks on the people, we still have it. There's and I think that is why this whole idea about making people aware that even though it's still going on every day. I hear people talking about this, and we should have a way of explaining to the people that the long COVID is a real thing, and us doing this these kinds of presentations and question and answer things. I think it is. I think we will finally have enough people understanding that it is a real thing. That long COVID is still a real thing, and then we should we should be aware of it. And as long as people are aware of it, then there'll be ways of going around, to make sure that it doesn't spread, or it's being taken care of. I just seen a question pop up for me, and it disappeared on me. Where do I go? Where do I get it from? The chat line?
Yes, I can read it for you here. It's
Okay.
a question for you. What herbs do you use for COVID and long COVID?
Could you repeat that, please?
Are there particular herbs or other remedies, traditional medicine remedies that you use for COVID and long COVID?
Not a medicine man. I believe in their medicines, so I cannot answer that particular question on what kind to use it for COVID or long COVID. The people that need to be asked that question are the people that use and put that thing together. So I'm not trying to be disrespectful to whoever asked me that question, but it's not my place to answer that question because I'm not a medicine man.
Okay, thank you. Actually, I do know, Angela, you work in integrative medicine and some bridging this traditional Western medicine regimes. Do you have any knowledge or comments?
I was the one who asked that question, curious about, what people were using. But I can reach out to, with Farwa's help, I can reach out to the medicine men people, folks as well. Yeah, I come from a traditional medicine background as well, but it's more traditional Chinese medicine. And so just learning about sort of what people have been using. So thank you.
That's great. And we have a question here that's not really related to Indigenous health and long COVID, but I just wonder if, Angela, if you want to take that one around leading cause of death for people with long COVID.
I think the rates of death in long COVID is low. I think compared to acute COVID, it's quite low. And sometimes what is hard to distinguish is did they die from the underlying comorbidities or did they die from something related to long COVID? So we can, like, I work in a clinic and we have run a observational study called CANCOV. And I can tell you that the death rate after the first like few months, you can even say a year, is very low. And even in acute COVID, the death rate in the non-hospitalized folks are quite low as well. But then obviously the folks who were having acute COVID in the ICU, the death rates are quite high. They are about 50 to 60%, depending on which population we're talking about. So, yeah.
Thank you. Yeah, we have a question from Lorraine. If any of the speakers could wave a magic wand, how would you change the approach to long COVID from what you know now? Perhaps, Maria, do you want to use your wand first?
How would I change the approach to long COVID? Like how doctors could approach it or how?
I think it's probably a general question about any approach to long COVID.
Okay, I'm going to speak for the most thing that has come recurrently in the interviews. So there's like not a very good approach when they go to healthcare practitioners. So they're discouraged and they're like mistreated probably, or saying this is not important, you don't have anything, you're fine. So if I could change an approach, I would be to increase in awareness and more information about this long COVID, or at least not discourage people, right? Not like make them feel like, because they're going through something, right? And we don't know how severe is their symptom or how not. So if I could change something, that would be the perfect thing to do.
That's great. And I don't know, RJ, if you want to comment, if you had a magic wand, what would you change?
Well,
And sorry, I forgot to say, of course, finding the solution, right?
Yes, yeah.
Sorry, Eugene.
no problem. Well, I think first of all, we're on the right track of trying to educate people about this, you know. That's my magic wand is all over the place. I got so many things I want to say, but I think the one thing that we need, that I would say is, if we, some form or the other, if we had a way of understanding what this COVID was about and educating the people that the COVID is a real thing. Because I've had colleagues, I've had friends, I've had family say to me and come in my face and say COVID is BS. It's not, it's nothing, it's not. And yet, all around them, they've had family members, they had their parents, and they had their friends die of COVID. And I don't know why they're be in a denial stage about it. And and I mentioned to them, I know the kind of music that you like. Well, we had musicians. It doesn't matter. COVID attacked anybody and everybody, and how we put up with it, how we fixed ourselves or whatever thing, what kind of medicine we use. It is a real thing. Now I know it came upon us all of a sudden. Well, let's not make it happen again. Let's find out, let's educate more and more people about this and say, well, okay, this happened, let's not it happen again. And these are the symptoms, and these are the things that we can do for our bodies and ourselves so that it doesn't happen to us again. I think that's the thing about, educating more people and continuing the journey that we put ourselves on, and trying to help people understand that yes, it is a real thing. Let's deal with it. Let's go with it. Let's acknowledge that it is real and let's do something about it. Thank you.
Thank you. There's a question from Daniel here about whether OSHA, or bare root is used at all, but you've said, RJ, that you'd prefer to leave that to a question for your medicine men. Is that something you'd like to respond to, or leave it?
Well, that's the thing about it. Like if you were to ask me about something about education, because I've been involved in education for a long time, or else going out on the land up here in the north or anywhere else for that matter, I would gladly answer it. But it's not my place, because I respect the elders and the medicine people for that thing. It's not my place for me to say, that this is what they use, this is what the kind of things that they use. So therefore, I'll leave it for them. And if they want to ask the medicine man, then we'll go from there. Yes.
Sounds good. I had a question about geography in Saskatchewan. I wonder if you could share your slides again, Maria, and go back to the picture of the province. And because I'm just curious what you consider north or northern. Is there a kind of a line or an area where it starts to become northern Saskatchewan? I don't know how much that varies across provinces. But...
You know what? We did have a lot of comments about that. There's a lot of discussion about what's north, what's south. I don't know if let me go back to the slide. So currently that will be talked and checked with MNS when the date comes, when the research. Right now we're looking at an overall map, and we clearly see we need more people up. We need people up in north, right? So where does it start? Where does it come? I think we will leave that to MNS and the Métis community, because they will tell us, but it is something that it's not easy. Like we've been like, where is this line, right? So hopefully when the study's on, we can describe that perfectly. But for the moment, we're not.
Great. Okay, thank you.
You're welcome.
I also had a question about for RJ, being a researcher, What advice might you have for other researchers about how we can make it easy and interesting for people to, and particularly Indigenous peoples, to engage in research? Is there anything we can do differently?
Well, my advice is, and this is all learned stuff, it's not written in anywhere, is for people who want to interview the Indigenous people, make them feel comfortable, okay? Show the respect that they solely deserve, because if you show them respect, they will give you the respect back in a heartbeat. And, you know, make it so that when you do, especially with elders, if you want to interview the elders and that kind of, you know, make sure that you follow the proper protocol in interviewing the elders. And what I mean by that is, if you're gonna interview an elder, take them a gift, because they are going to share something very meaningful to you about their lives, about what they went through, and all that kind of stuff. And even a pouch of tobacco is a thing that the way we do up here. Whenever we have questions about the elders, about anything in our lives, anything that has to do with anything, we present to them tobacco, and it's and then they'll say, okay, this person is very serious about what I want to tell them, what I want to share with them, and when you're done interviewing, ask them, see if you could share this information with other people. And if they say yes, then okay. And if it's no, then, you know, don't make a fuss and say, you know, explain to them what you're going to use it for at the beginning, who this thing is going to use this, and etc. And then from there, once they agree to the interview, and then, you know, just talking every day, boys, laugh about it, whatever it is that you want to laugh about, you know, make sure that they are comfortable with you and enjoy what they say, because they got tons and tons and tons of stories and information about anything and everything. And and once you made that connection with that elder or wherever you're talking to, you have a friend for life.
Mm-hmm.
And don't say, okay, all I want, this thing is over, I'm done with you. No, it doesn't work like that. You have a friend for life. Make sure that you give them a call, check on them once in a while, whatever you kind of thing you need to do. And that will work a lot more than anything else. Thank you.
Thank you. It's very helpful advice. Yeah, thank you. So question from Anna. Are there any plans to do future research on how long COVID affects Indigenous children and teens?
So far there's not a limitation. We have not put a limit like of ages. We haven't say like, oh, we're only gonna recruit from this age to this age. So it just hasn't happened to come that there's a young person asking for it. So I feel like based on what is found, it could be recommended, but it also could be observed that there was no person younger than 29 trying to report or self-reporting long COVID. So far, no, but if it comes, we will definitely put it a recommendation.
Yeah, I just wonder if you might do any targeted recruitment to particular groups or families or communities. Yeah.
Well, right now we're doing it. It is a target program. It's for Métis specific. It's not other but Métis specific in Saskatchewan, right? So this is really like as specific and as narrow as possible. But also we are trying to have a wide range of participants to check everything and make better recommendations.
Great. Thank you. And there's just a comment here, wondering if long COVID is underreported in younger age groups because of stigma. I think that's, again, a broader question, but an interesting one. Yeah.
It is very interesting. I don't really know the answer. What I can tell is that it has been observed that people that have a deteriorated health, like have cardiovascular problems, have everything, are most likely to show up the symptoms of long COVID and be like, or are more remarkable, probably. So when you face a younger people, probably they do have long COVID and is silence. It could happen because there's no other comorbidity going on or any other thing going on. But I don't necessarily know if it's because of that. It's a really hard question because long COVID is really a very unknown disease. And it's so far, there's nothing to diagnose long COVID, right? Everything is self-reported. So it's part of a huge gap in this thing.
I'm just posting the short survey about this session if anybody would like to offer some feedback. But I don't actually see any other questions. Sort of, I'll just give 1 minute for final round if anyone has any final questions. Anything else that you would like to say, RJ or Maria or Farwa?
The only thing I would like to say is that everything is very unknown, and it's like very frustrating that people really want to hear a solution, a treatment, and there's nothing we can say right at the moment, right? So same for some questions that we ask, like prevention of COVID. Well, was there a prevention in the first place? It got really spread all over, right? Like vaccines only show an effectiveness, but that's mainly it.
Okay, thanks. Farwa?
No questions on my end. Just thank you, Maria and RJ. That was a great presentation. Very informative too. And I really liked the comments in the chat as well. It got me even thinking about what we should be doing in the future. So thank you.
That's really helpful. Thank you. RJ, any final comments?
I guess my final comment is, let's keep going with this. Let's make more people aware of what's going on. And let's, in Saskatchewan, we're focusing on the Métis people, but we have a variety of other people in Saskatchewan that, eventually we would like to share with everybody and go across from coast to coast to coast and, make sure that everybody knows about this. So we're not, if it ever happens, knock on wood, it never does. But, at least people will be aware of this, of what to expect, or what, what they can do to make themselves comfortable with trying to deal with this crazy disease we had came from out of nowhere, as they say. But thank you for listening to my suggestions, and and hopefully we keep in touch, and go Habs go. I had to throw that
There you go.
in.
Pick your teams. There we are. Well, thank you very much. You've got a few supporters in the audience there. But thanks so much to all 4 of you for today's session. It was really terrific. Thanks, and all the best with the rest of this project. I think it'll be wonderful to hear more about it as you progress. So thanks so much.
Thank you.
Bye, everyone. Thanks for joining us.